Thank you. Avant de commencer, laissez-moi reconnaître que je vous parle depuis ma maison à Toronto, située sur le territoire traditionnel des Mississaugas de Credit, où nous honorons tous les peuples autochtones qui ont pagayé ces eaux et dont les mocassins ont parcouru ces terres. Thank you so much, Dr. Riley. Your positive energy is just contagious, and I was so grateful that our hosts, Dr. Montero and President Fletcher, were able to not only welcome us, but remind us about the power of the ones. But Elder Becker, I just want to thank you for that truly beautiful prayer and and really about gratitude and how it it is about giving thanks for our blessings and how important it is that that become part of our daily practice. And so I'm also want to let you know that and to acknowledge my amazing colleague and friend, la secrétaire parlementaire Elizabeth Brière, and that we're both honored to be here today to open the second KDE Hub annual um, symposium for the Mental Health Promotion Innovation Fund, which is um, doing such a great job focused on building momentum for mental health promotion in Canada. And I absolutely love the title, A Growth Phase for the Mental Health Promotion in Canada, helping it flourish. And looking at all those beautiful plants behind Elder Becker, I know that this is it's about flourishing. So I understand that there's over 250 people participating in this symposium and all across the country, and many of you are from organizations that have been working directly with your communities throughout this pandemic. And I guess we and the government of Canada wants to recognize the truly important work that you're doing every day, making a positive difference in the lives of Canadians. En tant que gouvernement fédéral, nous devons continuer de fournir les meilleurs conseils fondés sur la science pour lutter contre le COVID-19, ainsi que les pandémies parallèles auxquelles nous faisons face avec la montée des maladies liées à la santé mentale et l'augmentation de la consommation de substances et provisionnement mortel en drogues toxiques qui s'accroissent. The upstream work that you are doing to support people's mental health during these challenging times is going to be pivotal for the long term. While COVID-19 has indeed been difficult, it also seems to have made a little bit easier for Canadians to admit that they are struggling. And maybe now that we're a little bit more comfortable talking about mental health and mental illnesses and problems with substance use, I believe that we will be able to reduce the stigma that remains a barrier for those who are suffering to seek help. Parce que c'est OK de demander de l'aide. Nous devons garder les personnes en bonne santé, mentalement, physiquement, émotionnellement et spirituellement. Quelque chose que les peuples autochtones du Canada ont compris pendant des millénaires. As the first Director General of the World Health Organization, Canadian war veteran Brock Chisholm stated in 1958, there can be no health without mental health. Mental health is health. And throughout COVID, we've also learned that people can be apart, but not alone. And I was reminded by Dr. Tam that, you know, in 1986, the Ottawa Charter on Health Promotion agreed that we had to move from health care systems to systems for health. And that meant moving to a population health model that Canada and the Lalonde report had led. Tommy Douglas, long before that, had said that Medicare has to keep people well, not just patch them up when they get sick. And des systèmes pour la santé nécessitent de nous que nous traitons les déterminants sociaux mais aussi avec une face sur la promotion de la santé en amont et la prévention des maladies. It is the poverty, violence, the environment, shelter, equity, education, all of these things that you know so well. But as a mother and a daughter and a family doctor, and now, as you've said, Canada's first Minister of Mental Health and Addictions, I understand the magnitude and the complexity of the challenge and the ingenuity and courage required by communities and caregivers when they know that the system is not working for their people. Pour assurer que les systèmes faillissent, nous devons bâtir de bas en haut. De bas en haut, de haut, de haut en bas ne fonctionne pas. Seulement à travers une programmation locale qui comprend les besoins des communautés locales, nous serons capables de garder les personnes en bonne santé. The project leaders here today are working directly with their community and at the intersections of ingenuity and tackling the complex issues that can lead to positive systems change. There are some incredible community-based and Indigenous led organizations that are gathered here today, such as Kalyagiyapik and the Health Research Center, whose Inu Sigvik Community Wellness Hub is a pilot of a holistic community-centered wellness program for model for Inuit families in Nunavut, or also the Newcomers Employment and Education Development Services. Love the word needs Inc., which will work to enhance wellness of refugee children, youth, and families. And some of the ones I've come to know, Strongest Families and Community Food Centers. I just loved reading through the list and learning about all the good work that you are all doing. Vous comprenez tous que de résoudre ces besoins de base, ces déterminants sociaux de la santé, encore une fois, pauvreté, logement, système d'éducation, l'absence de violence, la sécurité alimentaire et plus important encore le sentiment d'appartenance et d'égalité. Tous ces systèmes offrent les fondations pour une santé mentale positive. That sense of belonging is something that we learned during the roundtables as we were setting up the public health goals for Canada and the public health agencies. And I know that that's what you are doing every day in your communities. So I look forward to learning about the conversations that you will be having over the next 2 days. The symposium is an opportunity for you to recharge and learn and build skills and connect with that common community support mental health promotion. So I really want to stress the importance of the efforts of every person at this gathering. As was said, the powers of the ones, but all sectors, all jurisdictions, all types of expertise, research, policy, practice perspectives, and all a place in growing field of mental health promotion. We are so much stronger together. And as practitioners and knowledge keepers, evidence builders, researchers, and funders, we can and do have collective impact. What kind of impact and for whom are perhaps more important questions to ask than ever. So thank you to Dr. Fletcher, Dr. Montero, and everyone at Renison College, and of course, Dr. Riley and the entire KDE Hub team for the incredible program they have planned for this symposium. So je vous invite à vous engager pleinement dans ces sessions et à tirer profit de toutes les discussions pour partir des connexions et des confidences durant cet événement. It is Kindness Week, and I just felt that that's the spirit of all of you who are gathered here today. And thank you so much for inviting me and allowing me to participate in this opening session. And I now turn it back over to Dr. Riley to begin the highlight of the session, the speakers and the gallery walk, and I'm looking forward to, as I explained to Dr. Riley, this is my brain spa when I get to learn from all of you.